Thanks for watching. Women, friends, fans, followers, aren't you sick and tired of being sick and tired each month? Of dreading that time in the month when your PMS rolls? Haven't you just had it with the debilitating, horrible cramps that ruin your life? Of repeatedly ending up in the ER when your menstrual migraines hit you like a 10-pound sledgehammer? Of the pain and anxiety and stress that occurs when your endometriosis flares every month? If this is you, let me share with you some options that can help you hopefully go to a better, more natural place that'll give you help in transforming to a better place with less risk for cancers and a better quality of life. Who am I? Why should you listen to me? My name is Dan Purser. I'm an MD. A lot of you know me. A lot of you have read my books or heard me speak or seen me speak or seen other videos I produced. I've had several #1 hits, best-selling books on Amazon. I speak all over the world. I do endocrinology research in this area. I'm including a textbook I wrote on preventive medicine. I educate physicians and patients and the public about all this stuff. So hopefully that gives you a little social proofing so you'll listen to me and hear what I have to say. I've helped hundreds of women get off the synthetics and birth control pill and narcotics merry-go-round and get them to transform and help them to transform to a better, more natural place. And that's where I want to take you if you'll listen. So why don't we start with an interview with Beth. She's a patient of mine, a great lady, really love her, super nice, and hear me interview her, and we'll go from there. Thank you again for listening. So, Beth, for what reasons and symptoms did you first come to see me?
I was tired a lot, had a lot of cramping with my period, and face complexion was awful, horrible, and generally just didn't feel myself, felt like I was quite a bit older than my age. I was 33, I think, when I came to see you.
Okay. I think so. How many years ago was that?
Over 10.
Wow, it's been that long.
Yeah, it's been that long.
So how did you first hear about me and from whom?
I first heard about you through my church.
Oh, okay.
And I first heard about you through you.
Oh, okay.
And your lovely
neighbor,
wife.
wasn't I? Yeah. So what was your major medical problems you had, your symptoms and all that?
My main issue was just the tired all the time. I felt like just couldn't function. Things were hard to do. Even just little chores were hard to do. And I didn't know what was wrong, and the doctor said I was just fine. And so I tried to believe it.
So what were they giving you? Any medications at all or anything?
I was on a birth control at the time.
Did it scare you?
A little bit, because what they did, it was one of those that goes right in your uterus, so that did scare me a little. Yeah, that did scare me a little bit.
Yeah. So did they ever look for root causes or dig a little deeper with you?
No, I, in fact, because my periods were so painful and I had a lot of digestive upset, you know, around that, thought my problems could be possibly linked to that. Actually went to even see a specialist, and they couldn't link them up. They couldn't, you know, they didn't. Yeah, they couldn't link it up, and they didn't think it was. I guess hormones weren't the word that you even used when you're in that doctor's office. I don't know.
Did I link those two up? I thought they were related, didn't I?
You absolutely did. Yeah, the second I walked in the office, you said, "You need it. I can see it on your face."
And what did I give you?
Progesterone.
And you liked it?
Yeah, it worked very well for me.
Still is?
Still is. 10 plus years later, still works phenomenally.
So how many progesterone? You take the RDTs or the capsules?
I do the RDTs, yeah.
How many do you take?
I'm prescribed between 1 and, I can't remember the rest, but right around there. But you told me, you know, just take how you feel, and I'm taking about 4 right now.
Okay, and you like that? It seems to work well.
It works great. 4 works great. Makes my skin great, helps my mental attitude, helps my focus. It creates a sense of well-being. I feel like my hormones are being balanced.
Do you sleep well?
very well because of it.
And you run, work out, and stuff like that?
I haven't been able to run for a personal injury in my neck, but I would love to get back to it, yeah.
You used to run a lot, didn't
A
you?
lot,
After you were on
daily.
Because I'd see you're out running every...
Yeah.
Okay. So were you scared to try these hormones when you first started them?
You know, that's a good question. Being science-minded, I kind of looked it up, and everybody gets the scare because the biggest thing they know about is the animal hormone from the mares. I can't remember what that's called, Premarin.
Yeah.
Yeah, and so...
Conjugated equine estrogens.
Okay, there we go.
Yeah.
So anyway, I trusted you, and I'm so glad because it helped and still does help.
Were you a little skeptical?
Not only, but it helps not only my physical, but my mental well-being. That was what the combination of the two
really does,
was powerful for me. Yeah, it was.
So you like these more natural options?
100%, 100%.
How has your life been different because of this natural treatment therapy you've been getting?
Well, I feel like I am adding to what's in my body, what's there, and so I'm building the way that it was meant to. I'm balancing the way that my body was meant to be balanced. And I will use alternative methods whenever I can.
Most women tend to prefer those, don't they?
Yeah, I think so.
So your PMS is gone?
Gone.
You sleep better?
Sleep much better. Go to sleep faster.
Periods are gone?
I have no pain. No pain. And I can always tell if I need to go up on my progesterone, like we talked about, before my period, because I'll get just an ever so slight, cramping, and that helps me to know, oh, you're getting close to that, and up your progesterone a little bit helps with everything. I don't get PMS anymore.
So do you feel like you're a lot more hopeful now for your future and everything?
Yeah, it's an antidepressant. It is a natural antidepressant, 100%.
What would this have cost you if you had not, health-wise, if you'd not been put on these? What would have happened? Where do you think you'd be?
Probably clinically depressed. I have a number of good methods to keep health in my body, and when I found this progesterone, I feel like it has enhanced every aspect of my life. What have I done with my life? Yeah. I'm breeding Great Danes. I'm one of the foremost Great Dane breeders in Utah now.
Cool. A lot of people are going to see this video.
Really?
Cool.
Oh.
Do you have a website?
I do have a website.
Give them the website.
It's sagemountaindanes.com. And if you have to have strength, and you have to have mobility, and you have to have mental acuteness in order to have a breed of dog like this. And this progesterone has made my life livable. It's made my life wonderful, and it's helped me realize that I can live my dreams.
Not just the progesterone, but the whole natural diagnostic approach and approach we took. It's all helped when you say
everything.
Okay.
Everything has made a difference.
It's
everything.
a little more reasonable way to do this.
Natural.
Yeah. You haven't been laser bladed. You haven't had to have a hysterectomy.
No.
Or any of that stuff. Okay.
No.
Good.
I have had a wonderful health in history.
Thank you.
Yeah. Thank you.
Okay. Did you enjoy that? So for the next few videos, I'm going to share with you tricks and tips and coping strategies to help you transform to a better, more natural place, to help you with your PMS, your menstrual migraines, and your endometriosis. I'm going to help you understand why you should want to transform away from the synthetics and the narcotics and all those kind of things that you're taking now that scare you, that give you a risk for cancer, that give you a risk for clots. And I'll show you the literature and educate you as to why there are better options out there. I'm not looking for new patients. I'm just trying to help you. I'm just trying to educate you and transform you. I'll help physicians around you find you as a patient, though, if you want. I'll help you find a patient. I'll show you tricks how to do that, too. So come with me. Hang with me. Let's have fun over the next few videos. I need some help from you, too. If you could please leave your comments and messages below. I'll try to answer everything. Remember HIPAA. We don't want to violate HIPAA, so you want to talk about friends, don't leave dates of birth, things like that. Don't ask me questions personally about you. I can't answer them. And I'll try and answer everyone's questions, and we'll have a lot of fun doing this. And let's see what we can do and how I can help you improve your life. Thank you. My name is Dan Purser, Dr. Dan Purser, and God bless and go in good health.